Hello, everyone. This is Dr. Shaw with Shaw Medical Travel Consultants, and today we have the pleasure of speaking with attorney Joyce Rayner, who is a federal criminal defense and personal injury attorney located in Houston, Texas. She is a president of her own firm, and the name of which is Rayner Carr and Associates, and she is a native of Arkansas. She developed a keen sense of fighting for freedom, justice, and equality by working as a high school student intern for a renowned civil rights law firm in Little Rock. She decided to attend Fisk University, where she received a Bachelor of Arts in English, and then Texas Southern University Thurgood Marshall School of Law. Practicing personal injury law has given her a bird's eye view of the medical field as much as the legal field. She's a member of Delta Sigma Theta Sorority Incorporated.
Sure, thank you for inviting me.
So what we're going to talk to you about today is going to be the opinions and experiences of you and your family, friends, persons in your circle who have an experience within the medical healthcare environment from the perspective of an African-American female and other females whom you may have relationships with or associations with by family or otherwise.
Okay.
And I'm going to start with a few questions. But just generally, have you had experience within the healthcare environment, you or your family members? Have you had encounters with the healthcare environment?
Absolutely. I think we all have had some sort of encounter with the healthcare industry. Particularly, I'm from a small town in Arkansas where the population was less than 500 people. So the surrounding counties and areas were rural as well. And we, in those types of places, good healthcare is hard to find. Quote unquote, the best doctors are not going to be located in those particular areas. So you might run into just having to go to healthcare clinics where there's one doctor that comes in, once a week rather than, every single day to see patients. So with that type of low profile with the medical field, we're not going to get the type of healthcare that we need in those particular type areas. So that's where I come from. And so the ailments that we sometimes had to wait longer periods of time to get them treated. They didn't get recognized or diagnosed early on. And, those are things that help participate in us not getting the proper care and timely care at that. So, yeah, I've had those types of experiences in general.
Mm-hmm. Thank you. So would you say, in your experience, one-on-one experience with the physicians, do you feel comfortable? Do you, your mother or any elderly people? Because certainly the experiences of your parents, your mother, grandmother, and obviously those experiences may be a little bit different from yours as a different time. But if you had taken your mother and grandmother to the doctor, and even from your personal experience, or maybe even your daughters, but whatever age group experience, did you feel comfortable and did you feel that you or your family members were being heard and or understood to your liking?
That's a great question, Dr. Shaw, because even though we grew up in a rural area, my time was different from my mom's time. I can give you an example as to even though my time was different from my mom's time, things have changed very little in those particular types of areas. Okay, so
history is not too long ago.
Okay, my mom was an older woman. She was an older mother. So as she grew older and started having high blood pressure, no diabetes, thank God for that, but having issues with her heart, lungs, etc. She was progressive in age, you know, in her late 80s. And at the time that she had a heart attack, the doctors were not readily accessible, you know, for her because she was in a such remote area, not, you know, real close to a major hospital and whatnot. But when we finally got her to a hospital, they were like, oh, well, you know, she's up in age, you know, we can just give palliative care. And until I sent a letter on my letterhead to let them know that this person's life is valuable, just like any other elderly person that would come through there, or any person that's not elderly would come through there. That was the only time that we started to begin to get the type of healthcare that I thought she should have gotten once she was, you know, initially admitted into the hospital. And it's unfortunate that you have to muster up that type of, you know, authority in order for you to get the same type of treatment that anybody else should get, you know, in a hospital. So yeah, I've had those types of experiences too.
So you think that education plays a big part in regard? I mean, so there are a lot of factors. So there's, you know, the socioeconomic, there's education, there's a lot of different factors. So, well, what's your opinion on the fact of education? Obviously, you're an attorney. Your mother was not. But so, what do you think that plays a part?
Absolutely. You know, the more I think patients. Let me say this first of all: patients have a duty to become educated about their own health care, to be aware of, you know, their bodies, to be aware of their physical ailments, as well as to inform the doctor so that the doctor can give them the type of care and treatment that is needed and necessary. So I don't put it all off on the doctors. I do know that we have a duty and responsibility to take care of ourselves and to know, you know, what to tell and ask the doctors. However, I know for a fact that because I am educated, not necessarily just because I'm a lawyer, but because I am educated, I do know that I have to inform the doctor of certain things that are ailing me. I have to have a list that I write down when I go and see my healthcare provider so that I can fully inform them of what's going on with my body. I do know that people are respecters of persons, meaning if I am another physician telling another physician about my healthcare issues, you're probably more apt to listen to me because I'm a doctor. Because I'm an attorney, maybe you might be a little afraid not to take care of me the way that I'm supposed to be taken care of because of the repercussions of not doing so. So unfortunately, that plays a role in it. It should not, but yes, I think education does play a major role in how good a healthcare you get. Yes.
And you think, now you mentioned you came from a small town in Arkansas. Obviously, Houston is not a small town. So, and you also mentioned that access to care was an issue because of living in a small town, and the lack of qualified, if not any physicians, maybe, in that area. So in Houston, not a small town, we still have an issue of access. And we also have an issue of people of African American or Black race and or cultures not feeling comfortable to access the care that is there.
Well,
what is your opinion on that?
I don't know about the not feeling comfortable of accessing it. When you have a healthcare system like we have in America, where it is so costly to access, it's costly to access because one, if you don't have health insurance, you can't go necessarily to the best hospitals, the best healthcare providers because why? You can't afford to pay them. Two, if you are on Medicaid or Medicare or some form of insurance that is not the quote unquote top tiered insurance, you still can't access those top hospitals or top doctors, or even if you do gain access to the hospitals, you may not get the necessary treatment that you need because that insurance won't pay for that, that particular procedure. So it's six in one hand and half dozen in the other, as my mom would say. So regardless of whether you are in the country or whether you are in a big city, access to healthcare for people in poverty or even middle class, lower middle class citizens have a difficulty accessing the best healthcare possible for them because of economics. It's economic based, basically, in my opinion.
Yes. Okay. Okay. Understood. So you've obviously had children, and you have children who have had children.
Yes.
So I'm going to shift gears a little bit and ask you about your experience as a pregnant woman. So can you give me a little bit of a recount of your opinion of how your pregnancy went? I mean, you obviously have a lot of friends who have had pregnancies and maybe in other racial groups. So, I mean, are there any instances where you felt, boy, I don't think this is quite right, or boy, I should have gotten what she got, or something to that effect? Did you feel slighted in any kind of way? And I don't want to put words in your mouth, because if you didn't, that's great. But did you feel at all that either you or maybe your daughter could have been cared for differently?
Well, I'll say this. With my first son, I was a teenager when I had him. And again, being from a rural area and having not necessarily the best healthcare possible, I had the best that area could provide. Okay. So as a teenager, I was probably ignorant to what should be going on with my healthcare. So I'm not apprised of how well my maternal healthcare was, except when I got to the hospital. When I went into labor with my first son, and this has less to do with my healthcare. I was a young woman, young teenager actually, with my first child, and going to a rural hospital to give birth to my child at the time was scary enough.
Mm-hmm.
It was not until after I had the baby that I encountered what I call systemic racism, you know, and it had little to do with not my health care. It had more to do with how the nurses and doctors actually viewed me, as a young mother. And
Okay.
what happened was my son's father and I were not married, and I wanted to put my son's father's name on the birth certificate, as well as my son's last name, his father's last name, give him his father's last name. And I was told, no, you cannot do that. You're not married, and you're a teenage mother, and you shouldn't have had the baby in the first place. This is what Black girls do. And so therefore, we're just not going to let you do it. Now, I was not old enough to fight that. You understand? And that struck me so badly. That was just one incident that within the healthcare arena that I saw how much racism can permeate into that particular field. Now, it didn't necessarily have to do with care or anything like that, but it just something that stigmatized to me, my son, who could not have his father's last name or nor legitimize him by placing his father's name on his birth certificate. So we've encountered all types of systemic and racism, unseen and unknown biases throughout this particular field all our lives. I know all of my life I've seen it. So that's just one example of it.
Yeah, that's a serious example.
Mm-hmm.
Did you, so far as, one of the things that I mentioned, obviously, that has not affected you and your family, but unfortunately the maternal death during pregnancy is unacceptably high within the Black culture, with the African American / Black race. And a lot of that education, obviously, and as you say, everybody has to take a part in their own care, but a lot of that unfortunately has to do with the healthcare arena not paying as keen attention to the needs and the complaints or symptoms or what have it of the mother who is pregnant.
Yeah.
You're educated. I'm assuming you obviously knew a lot of, obviously you're not a healthcare professional, but you probably knew a few things of what should and should not be done. But have you or your experience with your extended family members, things like follow-up, prenatal care, you're supposed to get that. And you're supposed to be advised of certain things that you're supposed to be doing. Obviously, everybody is different and all needs are different. Some are high-risk pregnancies, some aren't. And then, of course, there's postnatal after the child is born, follow-up and that kind of thing. Do you have any experiences within your family? What have been experiences that you've noticed in that arena, good or bad?
Well, I can give you at least one example. After my last child, thank God, I was in my mid to late 30s when I had my last child, which is, a high-risk pregnancy in and of itself after 35. I went into what is called HELP syndrome, where your blood pressure shoots up, your limbs begin to swell, you start being nauseated and vomiting, things of that nature. So fortunately, I was in Houston, the mecca of medical industry. So we have one of the best medical centers in the world. So thank God for that. But two, I had grown to know that choosing the right doctor was paramount to good health care. Okay.
Yes.
And I had an excellent doctor at the time, excellent OBGYN doctor, who was a Black female, who was in tune to her patients, who gave us her personal cell phone number. Thank God for that. I contacted her at 6 a.m. in the morning at her home. She said, don't wait, don't hesitate, get to the hospital immediately. So and thank God for that, because I had not vomited or anything, like, excuse the language, but just the actual truth at the time. But by the time I got into my car and my neighbor was taking me there, I began to regurgitate. Once I got to the hospital, she called me and said, have you regurgitated yet? And I said, yes. She said, let me call the hospital. The doctors in the ER kept me in the ER or triage area for maybe 30, 45 minutes, maybe even an hour. They had not sent me up to the floor where the maternity ward. I heard my doctor on the phone say to them, get her out of there, get her off of that floor and take her up, to the maternity ward. They were like, well, she's not pregnant anymore. She said, I don't care, get her out of there, because she knew what I was suffering was post pregnancy illness. It was related to my pregnancy. And so if she had not gotten me to where I needed to go immediately, then I could have easily gone into seizures, convulsions, et cetera, and all kinds of things could have happened to me. So I thank God for the type of doctor that I had at that time. I handpicked her. I think you know her personally, if I'm talking about. And we need more healthcare providers like that, who are in tune with their patients, who really care about healthcare rather than just chasing the dollar and what, being a medical provider can provide for you. What can you provide for the people that you're taking care of? So yeah, I've had that experience.
Unfortunately, it's been shown that well, it's fortunate actually, but it's also unfortunate in the fact that the outcomes of African American women, pregnant women, are better with Black physicians. When I say that's a double-edged sword, that's a good thing, but it's also a bad thing because there are not too many of them.
Right.
So there are more pregnant Black females than there are Black female kids to go around. So that's a good but sad outcome. And so I'm not surprised with what you're saying. I'm glad you had a good outcome, but it's unsatisfying. But I mean, it is, documented that this is something that can find. And the fact that in the emergency room, oftentimes patients are not, particularly Black women, and not just pregnancy, but heart disease and chest pains and things like that, pain in general, are not, and again, I say particularly Black women are not acknowledged as having what they say in the gravity and the severity that they are having. So a lot of times Black women and Black people as a whole, for example, don't get treated for pain adequately, okay? Because there's this erroneous myth, that Black people have a higher pain threshold. We know that's not true. I mean, there's no validity of that, but unfortunately, that is a myth. And so consequently, people of African descent, again, not just African Americans, but people of the Black race tend to not get adequately treated. And as you said, triaged in the emergency room, another issue as well. Oftentimes not paid attention so far as their symptoms and complaints.
Right. Now, I know in today's world, there are pain popping, people seeking illicit drugs to, sell on the streets or just abuse themselves. But unfortunately, I didn't know this until, probably the last decade, that we as African Americans are considered people who abuse drugs more often. The myth about the Black female being able to bear children without the medications, the pain medications or an epidural, doing without those pain relieving drugs, because you're African American female, you're better able to bear, children. I've heard all those kinds of things, which is ridiculous, but they play a role. Yes. They play a role in what type
of a huge role.
Yes.
Play a huge role.
And I'm just saying, I know you don't want to make a blanket statement about, it's great for us to, be able to just go to Black doctors or whatnot, but thank God for Black doctors, or thank God for doctors who are sensitive to our needs and sensitive to our culture, and we can at least say that we need more doctors who are interested in serving our communities, whether they be Black, white, Hispanic, it doesn't matter. But their interest should be in serving our community and learning more about our people so that they can serve us a lot better.
So I want to piggyback on that about learning and knowing. Okay, so in order to serve the Black community better, you have to have a specific understanding of of the history, of the economics, of where, can want to do the right thing and they can want to follow instructions, but there's a lot of socioeconomic issues and barriers that can prevent them from doing that, some of which you've already, mentioned just from your own personal experiences growing up. But there's a lot of things that prevent folks in the African American community from doing the right thing. And it's not that they don't want to, or not that they don't understand, if you even get past the education part, and that's, they understand, but there are just some barriers to being, quote, compliant. I don't like to use that word compliant, because it's not a willful non-compliance most of the times. It's non-compliance because there may be financial obligations that, there's a lot of different obligations that someone in the African American community may need to take care of. And unfortunately, healthcare can become second on the list of priorities.
Unfortunately, economics is a major role in how we care for ourselves, how the healthcare industry can run successfully and be successful for all of us participating in it, right? So we as patients are dealing with not only our illnesses and whatnot, we're dealing with our own economic issues, a lot of loss of jobs in this last year, a lot of reduction in pay because people just want to be working, and a lot of loss of healthcare coverage for people too, because their bosses can't provide the insurance any longer, and they can't, pay for it themselves. So it's a lot dealing with the economics of providing good health care, continuing to be a good healthcare provider. Economics plays a major role in that. So
it is, and it puts our healthcare system in a spiral because people are not able to are not able to take care of the needs that they know they want to, that they know they need to, they know they want to, but it is something that is very difficult for them to do. I'm going to ask you, I'm going to change gears a little bit and ask you about preventive medicine. So, and you can reference your mom, your whatever experiences that you've had within that. So, at certain ages, you are, certain things are recommended, mammograms. Obviously, the recommendations have changed over the years since your mom was going through that. At certain ages, certain recommendations are supposed to be made. Colonoscopy, pap smear, all these various different things are supposed to be made. And, oftentimes, whether, again, it be access, whether it be that there's, folks don't have an individual physician, they go to a clinic and, they're seeing, 60 patients a day. And so sometimes these things may get missed. Nowadays we have EMR, electronic medical records. And so, the doctors get little blips. Did you do this? Did you do this? And so that may help, jog their memory a bit. But, over the years, that has not been the case. And so folks have to remind people. I want to ask you what's been your experience in this arena as it relates to getting the preventive care, because we know that Black women oftentimes present late stage diagnoses. Okay, so they are not getting to the doctor, or maybe they're not being advised, or their access. A lot of things we've talked about, but for whatever the reasons are, their diagnoses are generally late stage, which is either more difficult or just not able to be treated.
Okay, which again, Dr. Shaw, it actually leads right back to the economics as well as the education. Educating our people that we need to go to the doctor at least twice a year is key. Even if there's nothing wrong with you, you need to get at least a checkup and a follow-up at least twice a year. That's similar to a dentist. Now, I'm guilty of not doing the dentist thing the way that I should do, but I do go to the doctor at least twice a year, even if there's nothing ailing me, okay? Then you leads again back to the economics. If Sister Sally Sue has no health insurance, she doesn't have Medicaid, she doesn't have Obamacare, she doesn't have anything, it's going to be difficult for her to make that appointment because doctors' fees are not cheap. You can probably find a neighborhood health clinic that will be a lot more economical or whatnot. However, you might go into that health clinic and it'd be 4,500 people waiting there, so that's a deterrent to getting, your healthcare needs taken care of, I'm sorry. But it's just education and economics that's preventing us from having the best health care situation possible in this particular country. I know that for sure.
So tell me, when you say education, so how can we, what does the healthcare environment need to do? So when you say education, I mean, we have, fortunately, the Black community is, the church plays a huge part in the Black community. Lots of civic groups, lots of sororities, lots of fraternities, YMCA. So there's a lot of that, and there's a good sense of family often also within the Black community. So where is the fault? Granted, I understand, like I said, you're an attorney, within your family, your mother was an attorney. There's a lot of people who are educated, but there's also quite a lot of people who are not educated. As it relates to healthcare education, what's the answer? How does that happen? Is it that the civic group need to step up the help? Is it the healthcare, the hospitals need to reach out? I mean, what's the answer there? What do you think is the best way to reach? And again, let me just say this, because when you are talking to different groups, the Latinos, the Black, I mean, the Indian, American Indians, the different Asians, different groups, the delivery and the way you present the information must be tailored, because otherwise it's not going to be adequately received. You can't say the same thing to everybody and expect everybody to get the same from it. So what's your opinion?
Well, I would love to make this a major role of the government. However, government has failed us royally in the past. I don't think that government intervention is going to play a major role in helping to educate and provide what the African American community needs in terms of getting the proper health care that we need. So having said that, I still think the government bears a role and can place funds in those communities so that people have access to different civic facilities that can help educate, the communities. One main thing that I know works, I said I'm from a small community, right, in Arkansas, even though I live here in Houston, Texas. I saw a need for legal redress in my community. So in 2005, I got licensed to practice law in that state. So now that I'm capable of, giving legal advice, litigating in that particular state, I got licensed so that I can help my people in that particular community. So we as African-American professionals, doctors, lawyers, businessmen and women who have the ability to help educate, help bring back the information that the community needs, it can start with us first, okay? I know that we love in our community going to church. That is one of the main ways of getting information to our people, is getting to the church house to make the announcements. You have more ears, more eyes, more understanding. And I know I have done it several times, discounted my fees, prices and whatnot to help, those who don't have access to, legal help. I've had to discount and sometimes do some things for free. It's okay to do some things for free. I'm not saying run yourself out of business, but we as professionals, Black professionals, have to be able to go back and assist our communities and educate them on, what we need to do in terms of taking care of our health and letting them know that they have access to, providers that are willing to work with them, so long as they can keep up their appointments and whatnot. So, the government can play a role. We as business people who are from the African American community can play a role. And of course, always educate people to do what they can do for themselves too.
Right.
Yeah.
Lastly, I want to ask you this now. If you're assuming let's put you in medical school as a professor, you're a professor in medical school, and you're responsible for teaching a bunch of young docs what they need to know to go out into the community. So what would be your suggestion? Because we know about implicit bias. We hadn't exactly talked about that, but we've referenced it in some of your own experiences. A lot of that was based on implicit bias of the physicians and the folks who are treating you. So what if you had to, you're teaching these students, okay? what do you suggest? How is the best way? What do these doctors need to know to treat you, your family, your kids, your mother, your neighborhood? What do these doctors need to know to reach you? I mean, again, you're educated, but not everybody is, okay? So what do they need to know to reach the Black community in a space where they are, so they can help themselves better their own circumstances from a health standpoint?
Okay, so I read an article in the American Medical Association's journal, as well as the American Bar Association journal had another article about implicit biases in the healthcare and workplace. And it enlightened me and opened my eyes to know that people are people, regardless of whether they're physicians, lawyers, assemblymen, whatever. People are people. So medical students are going to come to medical school with how they were raised, what their family genealogy is, and who they associated with up until the time they came to medical school, right? So that has shaped who they are, how they think, and how they treat people. So I would say if I were a professor, I would say to the medical student, examine who you are first in order to determine how you're going to serve the community and patients that you're going to be serving. More than likely, you're not going to serve just people who look like you. Yeah. So if you have not grown up or socialized with people who don't look like you, it's time to do that now. And I don't know if they can formulate a class, where they can take on being sensitive to other people's or other cultural issues that they're going to have to deal with anyway. It's coming into their office. So they're going to have to desensitize themselves and become aware of other issues that are permeated in their patient pool, so that they can be apprised of it and know how to address it when it comes, because it's coming.
Yes. Okay. I mean, that's huge. And I mean, I think, first stop and look at yourself and examine yourself, young doctor, before you get into, and actually that's advice that can actually be given to established doctors.
Yeah.
Okay.
Yeah.
Even now. Yeah. Okay. Yeah. So you need to first figure out who and what be aware of what's going on in your own world.
Right. So one other thing I want to say.
Okay, go ahead.
Dr. Shaw, our country has witnessed the insurgency a few days ago at the United States Capitol, right?
Yes.
A lot of people are shocked to know that in that group of people that stormed into the Capitol were doctors, lawyers, teachers, gold Olympians, et cetera, et cetera.
Yes.
And I said, those are people. Those are just the titles that they wear. So
absolutely,
it is not a shocker to know that some physicians come with not only implicit biases, but are racist. There are some physicians out there that are racist who are seeing Black people, Black bodies in their offices. So it just should not come to a shock that those types of people are also in those types of insurgencies. So having said that, we all need to examine ourselves first before we start to go out and operate and effectuate any type of healing for our communities.
And do you think, I mean, I agree 100%. Now, do you think also that the hospitals, the places that these doctors work, organizations that they work for, do you think there is some space for some kind of testing or some kind of evaluation of where someone stands in the scale of, I don't know if there's such a thing as scale of being, how racist are you? Or how biased are you, I guess is probably better way to put it. I mean,
yeah, I think what physicians, all types of professionals who are dealing with the public, the general public, should have some type of sensitivity training. The police departments have them, now, and I think all professionals that are touching the public in general should have that type of training done as well. So yeah.
Okay, excellent. And then the last comment I'm going to make, in this environment, again, physicians have a responsibility, but as you alluded to earlier, patients do too. So empowering patients to stand up for what they need comes back to education. You need to know what you are entitled to as it relates to advice from the healthcare department, as it relates to treatment from the healthcare department. So as a race, as a culture, as a people, the need to be able to empower yourself and say, I'm this age and I'm supposed to get, by my knowledge, this and this and this and this and this at this age. So do you think there is a place for working to empower the community themselves outside of the physicians and the healthcare department, or healthcare arena rather, to empower the patients to know what to be expected?
Sure. Oh yeah. In the age of social media, everybody and their mama is on social media, some social media platform, whether it's Facebook, MySpace, Instagram, etc. Even older people are on, they may be on the older platforms, but older people are on these social media platforms. So yes, Facebook, and I'll just use them as an example. They have the capabilities of doing push notifications. Exactly, is another area where, so that is definitely one way that these social media platforms can assist us in getting the information out to all people, not just us, but all people. And they also have search engines that are geared toward, African Americans. So I'm using Facebook again because I'm on Facebook a lot. Facebook, if you're listening to this broadcast, help us to educate our communities about where we can find good health care, how we can access it, how we can continue to get the type of timely health care that we need, because we are in desperate need of it in this hour.
Excellent. That I'm going to end on that point, because that is exactly what we need. We need that notification. We need that push. We need to get it in front of you, just like your car and your shoes and your restaurant. Right. We need that information in front of you so that you can see, oh, darn it, I need to get my mammogram. So you're right on point. Attorney Rayner, I am very happy that you took the time to speak with us. And again, we're really trying to push education and awareness. These videos are really for the point of awareness. So to our audience, we're excited that you're being a part of this as well. I'd like for you to take time to like this video. That Attorney Rayner was gracious enough to provide us her insight and knowledge. But also I would like for you to subscribe to our YouTube channel and website. So Attorney Rayner, thank you so much.
You're welcome. Thank you
for taking your afternoon to speak with us.
All right. Okay. Thank you.